This is a boob. Hi, I'm Suzie, women's health nurse and certified breastfeeding nurse. And today we're going to talk about breastfeeding and boobs. Most people think that we breastfeed from the nipple. That's this part right here. That is where the milk comes out of. But when it comes to getting a good latch and getting your baby to feed, you need your baby to latch around this dark part, which is also known as the areola. So when we talk about getting baby to latch on your breast, we really mean this whole areola. Some of us have fully inverted nipples, meaning this part kind of hides. That's perfectly normal. But baby needs to be able to latch. So there are ways that we can do this. We can stimulate the breast to make the nipple pop out and the areola, or we can use something called a nipple shield to help us. Hope you found these breastfeeding hacks helpful. Now you know how your boobs work and how to get the correct latch around the areola.